right? And the reason why is because one, we've had in the past that there's benefit to return to these webinars and referencing several of the discussion points of presentations, so that's a benefit. Two is because there's several who, for various reasons, including time zones, are unable to attend, and we want to make it available to them, right? And these, I won't read these verbatim, but these are just a few guiding, I won't say rules, but just some guidance about how we communicate, how we engage and have conversations virtually. I do want to point out at the end of the last bullet is that if you wish to have this presentation, you would like to receive this, please email directly to my email address is epenate@nm.org. Okay. So this is a two-part webinar series. And so today is the first one where we have some amazing presenters, Piret Pal and Kate Jones, who I will introduce in depth, and also as respondents, Joshua Hauser and Allison Kessenbaum. And thank you for your contributions today. And I will introduce everyone in a moment. The second part to this webinar is tomorrow scheduled at noon, and it's a panel discussion between some educators that have been in nursing in the spaces of physician training and also palliative care fellowship training, and having a conversations of how those programs have evolved in their settings as well. And Josh Hauser is helping us moderate that. This slide, I'd like to present why we decided to focus the annual focus on spiritual care training. And I'd like to emphasize that it's spiritual care training for non-chaplain clinicians. And I'd like to highlight some three points here of why we decided to focus on it this year. And one is that in different articles in the literature, we always find this recommendation about spiritual care training is needed. And there's a few colleagues that have done great work and have highlighted that spiritual care training to improve the provision of spiritual care, that spiritual care training was the strongest predictor for providing spiritual care. And I think that matters as we're thinking about this and why we do this, right? The others is that other colleagues, including one of our presenters, have found that there's benefits to spiritual care training, benefits for the patient, but also on our line of the experience as a clinician, that there's benefits for providers as well. And I'd like to highlight the last one, that even though I don't highlight some references there, that there's some practical implications here, because as a palliative care chaplain or a clinician, whether you're a nurse, social worker, chaplain, physician, there always surfaces these requests that ask us, can you give us a presentation? Can you talk to us about what you do? Can you, etc.? And I'll let you fill the blank. But there's this practical application for our work in the clinical setting as well, when we're invited to offer an educational presentation as well. And so why not have some colleagues, international colleagues, that have done amazing work with investigating what several have done in the past. I'd like to introduce Professor Dr. Piret Pal. She is the director of Palliative Care Institute at the Paracelsus Medical University in Austria. From 2017 to 2022, she was the deputy director of the World Health Organization Collaborating Center for Nursing Science and Practice, with a focus on palliative care education. She is a member of the WHO Palliative Care Partners Group, advisor in the EAPC and the INPCS educational groups. She has extensive expertise in innovative and immersive teaching methods and related research in palliative care. Her research is focused on palliative care education, spiritual care, and global health. Welcome. Our second presenter is Dr. Kate Jones, is a clinical social worker and researcher. Kate has worked as a social worker for 16 years in the fields of spinal cord injury, rehabilitation, and mental health. In 2017, she conducted a PhD to investigate the contribution of spirituality towards family resilience after SCI. Together with her colleagues, she has developed and evaluated 2 manualized spiritual care training programs, one for rehab professionals and another for all staff at St. Vincent's Health Australia. Kate has published over 20 studies in the areas of spirituality, resilience, and healthcare. She currently works as a research fellow for the University of Notre Dame and as a clinical social worker in older people's mental health at St. Vincent's Hospital, Sydney. Welcome, Kate. Alison Kessenbaum is a supervisor of spiritual care and clinical pastoral education at UC San Diego Health. She holds advanced certifications as a hospice and palliative care chaplain and works with the Doris A. Howell Palliative Care Service at UCSDH. Allison conducts research about spiritual palliative care education and serves as the spiritual AIM faculty. She was the first chaplain to receive a Cambia Health Foundation's Sojourn Scholar Palliative Care Leadership Award, as well as the CSU Shiley Haynes Institute Doris Howe Award for Advanced Palliative Care. Prior to working at UC San Diego Health, she served as director of programs at the Center for Pastoral Education at the Jewish Theological Seminary in New York City. She completed her chaplaincy training and worked as a chaplain supervisor at UC San Francisco Health. She earned her MA in Judaic Studies and MPA in Nonprofit Management and Public Policy from New York University. Allison is a board-certified chaplain and a certified pastoral educator. Welcome, Allison, and she's one of our respondents today. Last but not least is Dr. Joshua Hauser. He's an associate professor of medicine and palliative care and medical education at Northwestern Feinberg School of Medicine, palliative care section chief at the Jesse Brown VA Medical Center, and palliative care fellowship director at the Feinberg School of Medicine. He has spent his career involved in palliative care education at all levels, including as the director of education on palliative and end-of-life program. His specific educational interests include the role of medical humanities, spirituality, and the use of novel teaching techniques. Josh, thanks for joining us today and being one of our respondents. And I'd like to, how we're guiding this presentation is that Kate will present first, and then Piret, and then we will invite Josh Hauser to be the first respondent, and then followed by Allison Kessenbaum. Thank you again.
Hello, everybody. I'm going to share my slides in a moment, but I just wanted to, it's good morning from Sydney, Australia. I understand it's good afternoon to most of you, and for Piret, it's good evening. But yeah, thank you very much for inviting me to speak today. It's a great honor, and I'm hoping to learn from all of you, as well as hopefully you're learning something from our research as well. I also, just before I start today, just want to acknowledge that I'm speaking from the land of the Camaragal people here in Sydney, Australia, and they're the traditional owners of this land, and I just would like to pay my respects to elders past, present, and emerging. Thank you. I'll see now whether I can just share my slides with you all. Okay, can everybody see that okay? Wonderful. So I'm going to begin our session today just talking to you all and sharing our research on a systematic review that we did of spiritual care training for healthcare professionals. Thank you, Edward, for your introduction before. And as you said, I'm both a social worker and a researcher in this area of spiritual care. And I think I was first a social worker, and so my interest in spirituality and healthcare actually arose during my social work practice when I saw how important spirituality was for many of the people that I was working with at that time in spinal cord injury. And it's been a great privilege to take that I guess passion for spiritual care and to actually work in the research world and find out how much is happening in this space. And now I'm back working as a social worker as well as doing some research, and it's I'm very passionate about this whole area of spiritual care education. There's definitely so much potential for work, and it's exciting to see what's happening. And I understand that many of you are already doing wonderful things in this space. So I'm going to speak for about 15 minutes, and Perrette, I'm going to trust that you will interrupt me if I go over, and because Perrette's going to follow me afterwards. So I'll try to keep this fairly brief. So the aims of this systematic review that we conducted back in 2020, it was just at the beginning of COVID actually, and was a wonderful time to be able to stay at home and do a systematic review given what was happening globally. But the aims of our study were really to look at what spiritual care training programs have already been provided to healthcare professionals or students in the healthcare area internationally. So we really wanted to get a sense of what was already being provided in healthcare. And then when we, after we identified these programs, we wanted to know, well, what content, teaching methods, key outcomes, challenges and facilitators were highlighted by these programs. So just a really brief overview, bird's eye view. We identified 55 studies. 33 of those were quantitative, and the others were either qualitative studies or mixed methods. 11 of those quantitative studies included a control group, which is actually quite low. And I think we realized when we looked at those studies how valuable it was to have that comparative data. So only 11 of the 33, a third, included a control group. A lot of them were conducted in the USA or Europe, and I'm sure that's not a surprise to most of you. There's some great work happening, especially in the USA and Europe. So 75% of the programs were being provided there. And in terms of who was being taught, I guess, about spiritual care, majority of the participants were nurses, either students or practitioners. But then there was quite a lot of medical students, doctors as well, working in practice, and then other members of the multidisciplinary team. So a lot of the training was actually to multidisciplinary teams. So if we just look very quickly at what these programs included, what were they teaching when they were on spiritual care? Top of the list was spiritual screening. So I guess very much healthcare professionals and students are asking for tools, and spiritual screening tools are becoming more and more available. And so that's great. That was certainly a focus of much of the training. And the most commonly used tool was the FICA tool, developed by Christina Prukowski. So that was a very popular tool. Interestingly enough, that's not a tool that is known about much here in Australia. So I think we have lots to learn in Australia about different screening tools and how we can use them in spiritual care education. A second topic was whole person care. And I think this really resonates as a healthcare professional myself. Whole person care resonates very much with our work as healthcare professionals. And we want to look at the whole person, holistic care, and person-centered care. So interestingly enough, not many of the programs really looked at specific faith traditions or focused on that, but they were looking at, well, what's important to that person, that patient in front of you, and what does spirituality mean to them? And looking at that whole person, not just their medical care or even their psychological care, but their spiritual care as well. Then spiritual care encounters is the third topic that was really present in the training. And so this was really regarding how healthcare professionals engage on that topic of spiritual care with patients. And I found in my work particularly that this is what people want to know about. How do I have this conversation, this initial conversation about spirituality? Because it's the person that that patient trusts, in the nurse in the middle of the night, or the physiotherapist who they're working with in the gym. It's that person that they might trust to start talking about their fears and their concerns. And so for staff to have that confidence, to have that conversation is so important and so valuable. And so certainly looking at that area of confidence and comfort to have a conversation around spirituality. And it was great to see that that was included so much in the training. As palliative care professionals, I'm sure many of you will know the importance for healthcare professionals understanding suffering. And so that was also present in this training. And I think quite a few of the programs were based in the area of palliative care. Just touching on the other few here, definitions of spirituality and spiritual care. What I found when I was training healthcare professionals in this is that they need to know that spirituality is more than religion. And that's almost this light bulb moment for people when they go, oh, you mean it's not just about religion? And so including definitions of spirituality as a broad construct was almost across all the programs. People needed to explain that. Trainers needed to explain that to the participants, that what they were looking at and what was meant by spirituality. And just the last couple here, role of spiritual care specialists, so important, and that's staff need to know who they can refer to and who the specialists are, so that when they have that initial conversation, they can then refer on. And we've actually, with our latest program at St. Vincent's, we've included spiritual care specialists as the people training the staff. But yet in rehabilitation, we didn't have that. So it was just social workers providing the training. And I think both work, but certainly in this latest program that we've developed, it's having the spiritual care specialist lead that training is so valuable, because that relationship then is really developed between the non-specialist staff and the specialist staff. And last but not least, that awareness of personal spirituality. Yeah, Perrette and I think both agree that this is just so important, that the people learning about spirituality understand that that's something that's relevant for themselves. And just just as an illustration, one of our participants in the rehabilitation program was pregnant, and she said, oh, now that I'm pregnant, I notice so many other people who are also pregnant. And she said, now I know that I'm also a spiritual person. I see spirituality everywhere, and I really see it amongst the people that I'm working with. And so it was interesting, that illustration that she gave, that her awareness was so much greater now that she saw it in herself. So yeah, it was certainly an important topic. Just moving on to the teaching methods that the programs used. I won't dwell on this much, but just to say that it wasn't only lecture style didactic teaching. In fact, a lot of the programs incorporated group or personal reflection. And I think this is, when you think about, well, if we're talking to people about their own spirituality as well as understanding it amongst patients, then this is really helpful to have that reflection time either on themselves or with others. And the practical application of a spiritual history or screening tool was definitely integrated in much of the training, and very much appreciated. So what did this mean for the staff who came along to the training? And most of the programs really did just look at the staff outcomes. After training, what happened for the staff? And so they definitely had a greater understanding about what spirituality is, and recognized its importance, they gained through that, I think, an understanding of their own spirituality. And there is that sense, and I've come across it now with much of the training, that it's them understanding about spirituality is something that's about being human, and their interaction with patients is a human-to-human interaction. So that resonated with a lot of the people in our own training. Valuing the importance of self-care, recognizing spiritual cues amongst patients, being able to just be present with the patient and sit and feel comfortable with that conversation. An increased spiritual screening and documentation was definitely recorded for some of the programs and studies, and an increased referral to spiritual care specialists was also recorded. And definitely also an increased levels of competency and confidence for staff. I think everybody knows and is aware that there's definitely some challenges in this space. Amongst, certainly in Sydney and in Australia, spiritual care is not a healthcare priority overall. There's definitely a focus on the medical model and people's physical health over emotional or spiritual health. So I think we're fighting that challenge. It is a topic still, certainly in Australia, and I imagine across the world, that's considered taboo. People don't feel comfortable with it, and they need to understand it better before they gain that comfort and confidence talking about it with others. For some people, a focus on personal spirituality may be unwelcome, and they may not want that, and that may be for a whole range of issues due to experiences in the past. They certainly can feel inadequate, and certainly my experience is that ongoing training is required. People forget very quickly what they've learned, and so there's a need to integrate training on a regular basis. But our study also showed that there's a lot of facilitators for spiritual care training. It provides, when people have time to reflect, that certainly really helps. It certainly strengthens training when there's spiritual care practitioners involved, and I'm sure you all know that. It certainly helps when there's some application of practical tools and people can actually have a go at practicing the skills that they've learned. I think COVID's taught us that online training can be really beneficial, and certainly means that more people can be included in the training. And something that's come up quite frequently in my own experience, as well as was noted in this review, that managerial support is almost essential to be able to support spiritual care training in a facility. And it just shows people who are coming along, the staff, that there's that support right from the top. I've just popped this up here because if you would like to read more, this paper is the qualitative evaluation of our training with rehab professionals. And I just love what one of the occupational therapists said, which is in the title here: spirituality is everybody's business. I think if you can get to that point where everybody recognizes how important it is across the board, that's a wonderful place to get to. So I'm going to finish my section here and hand over to Perrette, but I look forward to some questions in a few minutes. So thank you. Thank you for listening.
Thank you, Kate.
So can you see my slides now? Please do something with your head.
Yes, we can.
Okay, thank you so much. And also warm welcome from my behalf. I'm joining you currently from my home in Germany, but I work in Salzburg in Austria. You know it all by Mozart and Sound of Music, I suppose. And that's how I teach, like the Maria from Sound of Music, all my students about spiritual care. If I could play guitar, then I would sing with them all the time. But unfortunately, I just have my nursing students a very limited time. And I think that I have built my own kind of model of teaching them. And the majority of time I spent with the self-reflection, and what all the nurses say that we didn't know that we actually provide spiritual care, and we didn't know that this is called the spiritual care. So, but it is important part of nursing. And yes, so it's all about giving them a vocabulary actually to speak about this phenomenon in care that seems to be very essential. And as Kate told about her path of becoming interested in spiritual care, for my PhD, I studied cancer patient narratives. And when I started to work in a clinic, I noticed how difficult or how much struggle it caused for, and the patients kind of in their stories, they said that they would expect the healthcare professionals to be more human. And then when I started to work with healthcare professionals, I saw that they were so helpless in helping as a human being the patients. So, and then that's why I have spent lots of time and effort into understanding that how to teach this being a human and not only a professional. And it was Edward already mentioned the review that I conducted some times ago. But before I continue, I always think that it is very important also to talk about the spiritual care definitions, because we don't have a worldwide consensus what spiritual care is or what we mean by it. There are definitions, but the people still struggle with it. And so I think that these components, this is put together of one nurse's experience and Paul Ricoeur's philosophy, how we make sense of the world. And so this kind of spiritual care, it contains self-understanding. So what is necessary for me? It is also this kind of interpersonal, so communicability, man-to-man between man and woman and different people. So this kind of interaction that we need for understanding also who we are as human beings, because white walls don't give us this information. And then also our negotiation between ourselves and the world, the surroundings, environment among us. So this is kind of how I perceive what are the important components in spiritual care. And Edward already mentioned the spiritual care training provided to healthcare professionals, systematic review that I conducted, and it is published in the Pastoral Care and Counseling. And we were trying to train when I worked still in Germany. We were trying to train physicians and nurses and other allied professionals in spiritual care, and in particularly in taking the spiritual histories using the FICA tool, which showed some kind of potential. But then we realized that even if the participants said before the training, and that after the training we measured their competency, they said, now I feel very competent and I will go out there and I am capable of taking the spiritual history or do this kind of screening. And from more than 300 participants, only 17 actually tried it. So it was a very negative study, but we still published it. But we published it and that has kind of made me think of how to do it better. And so, but what our healthcare professionals told us was that they found that the spirituality and this topic was so personal. It was much easier to talk about sexuality than about spirituality. And also they had the impression that it is very burdensome. And there was also this kind of feeling that they approached patients and patients said that, no, I don't want to talk about spirituality. It's not your business, kind of. And then they were also offended that I tried and people said that no, we don't want to talk about it. So also this kind of being a mature person and understanding that people have also right to say no to this kind of care, you know, and have their needs, you know, or maybe they have never thought about it. So so it's or patients know can be a very important sign for us, but it also, we have to respect if they say that, no, I don't want to talk about my spirituality. And now recently we had, last year in October, we had a German-speaking conference for healthcare professionals in spiritual care. And we have had this group for more than 10 years already. And they asked me also to present something about the implementation. And then I thought that, okay, since I published this review, suddenly there have been so many reviews that I decided to do an umbrella review. And I show you how many reviews from the past 10 years we could include. And there are some former ones even. And you can look at these topics and you will see that there is actually parallel. You have studies that are very similar. Lots of work has been done on nurses, some about midwives. Then there was one this kind of review done on for psychology students, and 2 on medical students, published in the same year. And when we think how little resources there, I don't know how about United States, but at least in Europe, we have very little resources for research in spiritual care. And then I kind of feel it like almost offensive that so much effort is put in producing these reviews instead of like thinking further. And there is like always, they refer to very similar studies. The only study that didn't have any studies to include really was about this kind of education in spiritual care related to childbirth. So I think we need really studies there as well. But this was a very interesting review in these terms, that it also said that it is not only the spiritual suffering, but spirituality and spiritual care can be also related to joy and love and cherishing. And so I think that in palliative care, we sometimes even tend to forget it, that like it is so much connected also about this kind of positive aspects of life. And we always think about needs, but we should also think much more about the resources, not only in the beginning of life, but also at the end of life. This said, I just, this slide is basically what Kate said. So I just put some things together. So it is well documented that people report higher competencies in spiritual care, that their attitude improves, and they also report a greater willingness to ask patients about spirituality. But the assessments that are done are usually like written essays or scale questionnaires, and assessment of different competencies related to spiritual care. And the problem is that if you speak to a patient, it is not a written essay, so it's a wrong method actually to understand what you have learned. So you should use kind of different means to do the performance assessment. And there are still, since I did the review and I joined Kate's group as well, there are only 3 or 4 studies that report this kind of long-term outcomes of such trainings. And there is very little studies actually assessing the impact of training on the quality of care that the patients get. So patient outcomes, we even don't really know what to measure there. That seems to be an issue. So you see that I poke around like problems here, and I think that it is important also to present the issues that we need to face to make our field stronger. But what were the good things? So there came out 5 aspects that support sustainable transfer of spiritual care into practice. And on the first place, and in most of studies, there was this cooperation with chaplains. So chaplains have an important role if they, nurses, for example, or also interprofessional teams, multi-professional teams, if they learn what chaplains do, that they are not just nice people who come once per week to the station and say, oh, do you have any patients to talk to? But like what they actually do and what kind of things they have at their disposal, then this leads to more referrals, for example, but also like people on the workplace, they maybe also their vocabulary develops more when they come to good terms with patients, and they get also more confident with the spiritual vocabulary. Then if you have this kind of teaching methods that shows, demonstrate or help to show how to apply what you have learned. So really like if you give a tiny assessment instrument and send them out there, and they have to document what happened actually. So this helps also to develop this kind of documenting skill, because rarely spiritual needs are documented in hospital. I think in United States is a little bit better, and you have wonderful books about this. But in Europe, we still have a problem that these issues are not documented, and there is no confidence, like how and what can I report. So you can teach the students also that, yes, write a little written report about what you heard, and think about also what can you report, and ask the patient, what can I report, like also in terms of confidentiality. Then one of the 5 things was the importance of role models and mentors, people really who are so good and lead by example, so that if you have, because we meet human beings, and sometimes we are in a better mood and our life is more balanced. But if we maybe are failing and mistakes happen, then it's always good to have some kind of role model or mentor at whom we can look, and we can even ask for supervision. So this seemed to be a very important in terms of that what you have learned will be also implemented in the workplace. Then also, obviously, this time factor comes up very often, but I think that this is also a researcher's problem, that if we ask about the time, because, you know, in many also not only these systematic reviews about education, but in many studies, if researchers continue asking about time and education, then the participants always will answer that we don't have any time and no education. So we're kind of producing this, but obviously it is a very busy environment. And then if you have a good team, then your organization tells that it is important in the work environment to look at the spiritual care and document it, and also so this can support also the implementation, and also that you have models, this kind of how to teach spiritual care, and that you also have a protocol for that. So, but this is an area definitely that needs more elaboration also. And then implications for future research in terms of, and these are really like problematic things that I think we have to look into. Opportunities for sustainable change based on evidence are not sufficiently considered. So it's always like, let's make a program, let's evaluate it, but like how to make a sustainable change, these are probably more, which I already reported 2015, is if the work environment, if the work milieu changes, it supports workers, and then also they are more willing to do the spiritual care work. Then measures of spiritual care implementation in practice or patient outcomes is lacking. So there we need to do more work, at least in regard like what effects education has on it. Then one issue is a bias that is rarely addressed, but The authors who study this area predominantly have a Christian background. So I have recently been invited also to talk about spirituality in India. And I feel, for example, at their trainings, and I feel very uncomfortable in some, because I think that we have this kind of dualist worldview in Europe and maybe in Western Europe, and we just don't know really much about what the spiritual needs could be, or what are the values and beliefs that matter really. And so this can be even a little bit like colonialistic, that we have this, all teachers have a Christian or humanist background, but we don't think about our own background really, or we don't address it in our work. And so there were also, from the papers, from the discussion part, there was said that spiritual care training may be discriminatory. So in both ways, if only the major world religions are addressed, as well as if their contribution is neglected in the curricula. And there is no clarity also how to address the needs of agnostics or atheists, or how multi-denominational the content actually is. So it might depend on the teacher, it might depend on organization, and what it may lead to is that it might have possible negative effects of spiritual care training program on students. For example, they have fears, feelings, to be pressured to change their own views on spirituality. So I always have been, after we had this major failure in teaching people how to screen for spirituality, I think that I have always warned that we have to be very, very cautious with those trainings. And in particularly people who are hesitant about this. Usually we get people who are very interested, but if we get people who are like hesitant about this topic, and I meet them every month, somebody who says that, oh my God, I'm not, they say, oh my God, I am not a spiritual person, you know. So, and then after the training, they say, oh, I didn't know that I am a spiritual person. And so to be very cautious in the trainings, and also very authentic and open about your own background. These are some references, and this is my final slide. So thank you for listening. Listening is learning, and now I'm very happy to, I don't know, how do I stop this now? Oh yeah, well, I have to say stop. So thank you very much, yes, for listening, and I am looking now to your discussions. Thank you so much.
First, Kate, thank you so much for being with us and being part of our community of conversation, reflection, and thank you for presenting on your excellent work. And I just want to really highlight your past publications for anyone who is further interested, because I think they are key pieces of literature that we should consider as we think about spiritual care training for non-chaplain clinicians. So thank you. All right. I want to invite Josh Hauser now to offer his reflections, his responses to the presentation. And I also want to invite the public. You have your own reflections and impressions, and so write your questions and thoughts on chat, please, okay?
Thanks, Edward. Edward and I are attempting to do simultaneous audio, so I think we're okay. I want to thank Edward for organizing this event, and thanks all of you for being here, especially all the time zones. And just to situate, I'm in a conference room in Chicago, actually Evanston, Illinois, with Edward and with 4 of our palliative care fellows. We have a monitor that's over here, so I may look that way sometimes, and that's my movements, if you notice. I want to make a few points about each of the presentations that I just heard, which were very meaningful to me and taught me a lot. And first with Kate's presentation, I hope it's okay to call you both by your first names, even though I've never met you before. Kate, one of the things you started off by saying, and this connects with what Pierrette just talked about as well, is that 75% of the studies were from the US or Western Europe, which in my calculation is one continent and one country in a world that is 7 continents or 6 continents with populations of people. So sort of your acknowledgement of thinking of that as a challenge for our field and how we include Asia and Africa and South America, et cetera. Second point that I want to make about your presentation, which stood out for me, is the list of the content of the trainings that you looked at. And at the top of the list was spiritual screening, which is a sort of an attempt to be systematic and consistent with how we look at spirituality. And you talked about FICA as an example of that. And then second was whole person care, which to me is almost the opposite of screening. So it's what I think all of us on this call would seek to do in terms of a more nuanced, organic, spontaneous, deliberative, et cetera, approach. And I think that's just a really interesting balance or tension between the sort of ways we approach spirituality. And then the last point that I want to make from your presentation is you talked about that person they may trust, who might be a nurse in the middle of the night, or I think you said a physiotherapist, or it might be a transport worker, or it might be a nurse's aide. And the idea that so many of us in this adventure called healthcare need this kind of training and need some of the basic skills, which, you know, in palliative care we call primary palliative care, so primary spirituality that can equip all of us, regardless of background, to explore some of these topics with patients. So those were 3 things that I want to sort of note from your presentation, Kate. Fred, thank you for your presentation as well. I couldn't help but react when you said 300 participants and only 17 used the FICA. I think you said something like that. Again, which I think might point to some ambivalence that people might have, or hesitance, or something. I don't know, but I thought was an interesting finding. And then you cited some examples of people talking, we don't want to talk about it in terms of perhaps its import or its scariness or something like that. And then I love the quote you said about the connection with joy, love, and cherishing. I couldn't agree with you more, and that's sort of part of the way that I personally see spirituality, and I hope with patients and colleagues and friends as well. So I appreciate that. And then 2 last points. One is in one of your later slides, you talked about cooperation with chaplains and role models and mentors. And what that made me think about was, well, I guess what I'm noticing in the room that I'm sitting in with the 6 of us and on the Zoom screen is kind of the importance of having colleagues in a community in this work. And I don't believe that just about spirituality, but I especially believe that about spirituality because it may be a little bit more of a new topic for so many of us in healthcare. And then lastly, and this connects with the first point I made about Kate's presentation, some of the potential blind spots we might have, or even negative effects of some of these studies and some of the areas we haven't looked at around one's own spirituality, around how these conversations might be discouraging at times, and about some of the inclusion of other world religions and world spiritual context. So thank you both for such evocative presentations. I appreciate it.
Thank you, Josh. Thank you. And time for a response for Allison.
Great. Thank you so much, Perrette and Kate and Joshua. Just to sort of situate myself a little bit, I'm here in San Diego, and I wear the hat of a spiritual care manager, a staff chaplain, and also oversee our clinical training program for chaplains. And so I think a lot about the education question and also the sort of formal and informal ways that other disciplines are learning just by virtue of being in contact with us as chaplains. This is something we believe to be true, but I don't know to what degree that has been studied. So, but you know, it was really striking to me that as an educator, if I were thinking about, you know, planning and implementing spiritual care training for non-chaplain clinicians from scratch, it would be tremendously helpful to have both of your studies actually as a blueprint. And I don't know how valid that is to set up a pedagogical model in that way. But it was interesting because it just really paralleled a lot of what I, in my work as a chaplain and the research that I've done. It hits the points that we are trying to impart as educators to clinicians of all disciplines. So I just thought that was really kind of interesting. And I thought, as we go back and look at our curriculum and also the way that we teach other disciplines, for instance, we do a lot of work with training our hospice and palliative medicine fellows. How does that line up with what you all found? And I think just a couple of points that I'll make, things that really jumped out at me. It was interesting to hear that a lot of multidisciplinary team members were being trained, but also just the importance, but just the predominance of nurses and nursing. And, I think that partnership can't be understated, and there's all different possibilities there that run very deep in our, in our disciplines and our traditions. So I'm always interested in looking at that. And then also, it was really exciting to hear actually that screening tools and whole person care were two of the top in Kate and what you presented, because that's what I would have hoped. So that's just kind of interesting that's sort of what bear out. I was a little sad that the personal spiritual practice was sort of lower on there. And I'll talk about that in a minute. I was actually in another presentation today with Betty Farrell, nursing spiritual care leader and researcher. And one of the things we were talking about a project that several of us are working on is, we're trying to screen patients, but what we're finding in the spiritual screening of patients is that the spiritual distress of the staff members are coming out in all kinds of very interesting ways, right? So yeah, Rick knows all about this project. Yeah. And so, that is just very real. And it's not necessarily something clinicians would have identified for themselves until they were kind of in that situation, or even, accessing that language. So I think this is something we all know, but that's just sort of a real life example. I also really appreciated, Paret, which you shared about the whole dynamic. I appreciated so much of what you shared, but the dynamic of the right to decline spiritual care, and that sort of autonomy piece and what that means for the provider and for patients. It's so potentially fraught. And there's also so much potential for healing, whole person healing, when the spiritual domain is addressed, but there is that potential for that missed opportunity or overstepping the line. So I appreciated that coming out, and also that can be taught. I actually really, I see CPE students, clinical pastoral education students, learn how to do this every unit about how to engage with a patient who's declining or tentative or has maybe a difficult history with. So it's just interesting to think about that as a pedagogical model too. And then just one thing I'll say in closing, and I sort of felt sparks of this here or there, and I'm a chaplain, so I just kind of see the world in ritual sometimes, meaning like, I'm just thinking about how learners of all disciplines are actually learning about spiritual care through the various rituals that they're experiencing in their training and in the clinical training. And so what I mean by that is some of these can be very explicit. Like, so for instance, we, in our palliative care team, we have a ritual where we go to the beach, and this is a beautiful thing we can do in San Diego. But what we did, we had a lot of learners there. We had our chaplain learners, we had physician learners, and we did this ritual that some of the chaplains came up with, where we filled vessels with water. We poured them into one large container that was filled with bubbles, and the smaller vessels represented the tears of our, all of our providers and our learners, right, in caring for people at end of life. And then we made these giant bubbles and released them into the beach, and like, I think that's a pedagogical moment for trainees. I don't think they'll ever forget that, right? And there's so many themes there about spirituality and whole person care. And, I think we have these very explicitly if times of remembering happen in an institution, but there's also the ways in which that is integrated into a team meeting in a very, more subtle ways, the way that we remember, the way that we process the various dimensions or acknowledge the various dimensions of our spirituality. So, that's probably a whole other study, but that language is likely not even expressed in that way. And, so I just would encourage us to think about how those that are in our training are sort of learning through the example that we set through ritual as well. So thank you.
Thank you, Allison, and thank you again, Josh, for being both our respondents today. And I'm wondering if Kate and Pereira have some reflective comments or insight after you heard the responses that they want to share as well. I want to give you both an opportunity to share those if you have them. And if not, I have a few questions here that they've submitted through chat as well.
Oh, I would just say that really great. Thank you both, Alison and Josh, for your thoughts. And I think there's just such a wonderful discussion to continue in this space. So yeah, really rich responses. Thank you. Thank you very much. And I just wanted, one thing that came to mind was someone in another discussion previously, someone said, oh, this spiritual care education is like first aid training in spiritual care. Like it's teaching everyone how to provide that initial care to someone who's in need and who's reaching out for help. So yeah, it's a real privilege to be working in this area. Yeah, thank you.
Yeah, I just want to do some advertising also that you're all welcome to join our conference in Salzburg so that we can meet personally next year in May. Also some guests from United States will be there, but like more is merrier. So just come and let's continue this wonderful conversation. And and thank you very much for having me and for the respondents, but for their answers and ideas. So I think there's still a lot to do, but we have to also become better in what we do, and more reflective and critical is my message always. So but you said you have questions, so I would love to take some questions.
And we're at the top of the hour, and so I want to be mindful of that and respect that as well. I will ask one question because this has a lot of implication with your work, the responses that Josh and Allison said, and is we talk about spiritual care training for non-chaplain clinicians, and how the spiritual care training to be educators of those programs look like for chaplains, that not all chaplains are trained to be educators, for social workers, for nurses, etc., to be the educators for such programs. So I'm wondering if anyone on this, whether Kate, Fred, Allison, Josh, have any thoughts about that?
Well, I have very openly always said also when I educate, and people have been very mad at me when I tell that if you don't know why you are taking spiritual history or why you are asking about spiritual needs, if you are not sure why you are doing it, you shouldn't do it. And then people are like, oh, but we are like, so if it's not part of the care plan, or if you have no idea what happens afterwards, people will get therapeutic expectations. And so it is not something one should pursue. It's like open heart surgery. Maybe we can cut a person open, but we cannot put him or her together anymore when we don't have the competencies. And well, with education is like that. Sure, you have to be very authentic, I think, and you just have to, if you try to kind of teach people about your own spirituality, what does it mean to you, and go from there and give lots of space for reflection for participants and pick them up where they are. I think that's really my experience. I don't know what your experiences are. So
I think we've had a bit of a discussion in Sydney, and I just put up an article link, just a reference earlier about some conversations we had with pastoral care practitioners at St. Vincent's about spiritual care education. And they said themselves that they didn't feel confident in this education space. And certainly that's an area, I guess, that maybe needs some attention. But one thing that really came across in this stuff, in the training that we've been developing, is that spiritual care practitioners model spiritual care even when they're teaching, and that was really picked up by some of the healthcare professionals who came along to training. They said, oh, she made us a cup of tea and she just sat with us and we just talked, and we just felt cared for in that space. And so without realizing it, this chaplain pastoral care practitioner was modeling spiritual care. She was looking after their spiritualism even in that training. And so I think it's recognizing as well that whether it's education or with patients, there's so many opportunities to model what spiritual care looks like. So yeah, but definitely a conversation that can be continued.
Thank you. Anyone else?
Edward, can I add one thing? So this is building on what you just said, Kate. I think one thing that's so interesting about this part of education for me is that we're calling on kind of diverse disciplines to come together and share their educational traditions and their educational expertise. And I think that's both an opportunity and a challenge. And what I mean by that is, we have different ways of doing medical student education or MD education, different ways of doing nursing education, different ways of doing chaplaincy education and social work education, et cetera. And we talk about how interdisciplinary we are, and we strive for that. But it also requires, again, sort of bridging different traditions of training and education. And I think when we are receptive to that, we just go so far and learn so much. And I totally agree with you, Kate, sort of in our actions, not even in our explicit education, but in our role modeling, we can go a long way for that. So I appreciate those points.
Thank you, Josh. Thank you. Allison, I'm just double checking just to see if you have any reflections on that.
Just this kind of conversation is a delight, and to be able to come together with people who I've either only met once or never met before, and to be able to even have just a shorthand that we could speak in. I mean, that wasn't even the case, a while back. So I'm just really heartened and delighted by that, and just feeling the sense of connection around the world is very powerful.
Thank you again, Drs. Jones and and Allison and Josh for responding. Thank you, everyone. I hope you'll join us tomorrow at noon Central Time for our second part of this webinar series on spiritual care training with non-chaplain clinicians. We'll have conversations also with Betty Farrell, Gauri, Josh, and myself about different programs of spiritual care training. Thank you so much. Bye, everyone.
Thank you, everybody. Thanks so much.
Thank you